going to talk about minimally invasive hip surgery, which I and a number of colleagues around the country have been doing for up to 8 years or so. It started in the orthopaedic community really in 2001 when Richard Berger got up on stage. I saw him in Orlando in 2001, and he showed a patient getting up and walking a few hours after hip surgery the same day. And at that stage there was a gasp from the audience because it was completely unexpected and completely new. The length of stay at that stage was round about 10 to 12, even 14 days, with quite a prolonged, slow recovery. Patients normally wouldn't get out of bed at all till the following day, and some surgeons even kept patients in for 2, 3 and even 4 days. We started to realise that people with hip arthritis had a painful hip, and then a hip replacement is a pain-free hip, and therefore if we were swapping a painful hip for a pain-free hip, why couldn't they walk? What were we doing that was preventing that mobility? And there was a focus on the anaesthetic, the way that we approach the muscles around the hip and the soft tissues, the education of the patient, and the amount of positive or negative psychology that was involved. We understand that education on a one-to-one basis, pre-operation and pre-operative physiotherapy and optimum preparation prior to surgery is important. The surgery really needs to be minimally invasive, respect the soft tissues, minimise blood loss, provide an accurate and stable hip replacement that a patient can comfortably walk on that day. The way that this has been popularised in the UK, and all credit to Hugh Apthorpe and his team in Hastings, is to use a low-dose spinal anaesthetic. So that's a full spinal anaesthetic but using half the dose as normal, and this really means that it'll wear off more quickly, so it wears off at 3 hours as opposed to 6 hours. The epidural therefore does all of the work, keeping the patient numb from the waist downwards. The patient will feel very bright and fresh with no sickness or heaviness or grogginess, and actually sit up in recovery, so there's no drip or any other attachment that used to bind patients down.